guys, how are you doing? I'm hoping you are doing well, and welcome back to today's episode of learning. How have you been? I'm hoping you are well. So today I want us to discuss a very interesting topic, and also a very common disease among children. Um, and today I want us to talk about acute diarrheal disease, or gastroenteritis. So, what is gastroenteritis? Gastroenteritis is inflammation of the stomach lining leading to diarrhea, vomiting, or both. Gastroenteritis is inflammation of the stomach lining leading to diarrhea, vomiting, or both. And it is the most common digestive disease among children. It's the most common digestive disease among children. And diarrhea, any baby who has 3 or more episodes of diarrhea within 24 hours. 3 or more episodes of diarrhea within 24 hours, that qualifies to be called GE, or acute diarrheal disease. And so gastroenteritis is classified to two. We have acute diarrhea disease and also chronic diarrheal disease. Acute diarrheal disease is a diarrhea that lasts for less than for 2 weeks and below. Acute diarrheal disease is a diarrhea that lasts for 2 weeks and below. And chronic diarrhea is a diarrhea that lasts for 2 and more weeks. It lasts for 2 weeks and above. That is chronic diarrheal disease. And so today we will handle acute diarrheal disease. That is the most common diarrhea among kids, acute diarrheal disease. And so we will just go straight to the causes of acute diarrheal disease in babies. Number one, we have viruses. The causes are, number one, we have viruses. We have rotavirus, we have norovirus, and we also have adenovirus. Rotavirus is the most common cause of diarrhea among the viruses. We also have bacterial causes. We have a bacteria called E. coli, and we also have a bacteria called Salmonella. We also have parasites that cause diarrhea. One of the examples, we have a parasite called E. histolytica. And acute diarrheal disease in babies is mostly caused by viruses, and the most common virus that causes diarrhea is called rotavirus. That is the most common virus that causes diarrhea. What is the mode of transmission of these viruses or bacteria that cause gastroenteritis? The mode of transmission is fecal-oral route. Fecal-oral route. That means it's transmitted through the feces. So anybody or any baby or any person who is infected just passes stool, and then if people don't practice proper hygiene, you will come into contact with the virus that comes out through the feces, and then you will take it through your mouth orally, and then it will just go into your GI tract, and that is when it will cause inflammation. And so the mode of transmission is through the feces to the mouth. You might, it doesn't necessarily mean that you will consume the feces, but when someone passes a stool, for example, let us say that a mother is handling a baby, she's changing diapers of a baby who has the rotavirus, and then if she doesn't wash hands after changing the diapers, you might come into contact with the virus, and then if you don't practice hand hygiene, you will go maybe going to feed another baby. That is one way you can transmit it. Or people who pass a stool in the swimming pools, if someone has diarrhea or has is infected with this virus, and then goes to the swimming pool, passes stool there, and then people who are swimming taking that water, that is how you will easily get the virus. So what are the symptoms of acute diarrheal disease? The symptoms are classified to three. We have mild symptoms, and the mild symptoms, you will find out that this baby has a dry mucous membrane, especially the lips. You will find that the baby's lips are dry. The baby is thirsty, asking for water, and also the baby's urine output goes down. If you are used to change your baby's diaper like after let's say 4 hours, this time round, because the baby is diarrhealing and also vomiting, he or she will lose a lot of water through diarrhea, so that means the urine output will be low. Under moderate symptoms, we have a dry mucous membrane, still we have dry lips, we have sunken eyes, that is self-explanatory. You can see the baby's eyes going deep inside. We also have lethargy. These babies, they're just tired, they're fatigued, they're not active. You also have reduced skin turgor. By this I mean when you pinch a baby's skin, it should go back within a second or less. But these babies who are diarrhea, you will find that their skin goes back slowly, a period of more than 1 second. That is what we call reduced skin turgor. And also they have fever. You will find that they have fever. We have severe symptoms, and under severe symptoms, you will have that the baby has both mild and moderate symptoms, plus they will have cold limbs. They will have reduced consciousness. They will have a fever, that is a high temperatures. They will also have poor appetite. Under severe, the baby will have both mild and moderate symptoms, plus cold limbs, reduced consciousness, fever, and also poor appetite. So what are the danger signs? What are the danger signs when your baby is diarrhealing or vomiting? If you see these signs, just know that that baby is in danger. Number one, if the baby has a sunken fontanelle. What is a fontanelle? A fontanelle is when a baby is small, you will find that there is a space here. When the bones have not fused, they have a space here that is soft. That is what we call a fontanelle. So if you notice that your baby's fontanelle has sunken deep, if you notice that your baby has a sunken eyes, the eyes have gone in, you notice that when your baby is crying, she or he doesn't produce tears, that is a baby who is diarrheal or vomiting. And when they cry, they don't have tears, they have dry lips, they have no urine, they are lethargic, they are tired, and also they are restless. These are the danger signs. These are danger signs, and this baby has to be rushed to the hospital to be seen by a doctor. How is it diagnosed? How can the doctor tell that your baby has gastroenteritis? Number one, we have clinical diagnosis. This is when the doctor uses the symptoms that you tell, you explain. Through the clinical features, a doctor can tell that your baby is suffering from gastroenteritis, but then he will need to do stool tests. Stool tests, a virus like rotavirus, when the baby is infected, it will appear in stool, so your doctor will order for stool samples to be tested for rotavirus. Your doctor will do a blood test called the UCs, urea, creatinine, and electrolytes to check when this baby is losing water. They also lose electrolytes. So he will check for creatinine. If creatinine levels and sodium levels are high, that means this baby is dehydrated. The doctor has to check for glucose level. This baby, because they have not been feeding or they don't retain feeds, the doctor will want to know how is the blood glucose level of the baby. The doctor will also check for a full blood count to check if the cause was a bacteria or the cause of the diarrhea is bacteria. What is the management? Once your doctor has found the cause of the diarrhea, the baby needs to start on immediate management. Actually, these babies who diarrhea or vomit, they need to be treated as emergencies, because they might be walking around, but they are severely dehydrated. So the baby needs to start rehydration immediately. They get to the hospital. If the baby is able to feed and retain, the baby is only diarrhealing, the baby should start on ORS. And also, if it's a baby who is breastfeeding, the mommy is encouraged to breastfeed. If the baby is vomiting and not retaining any feeds, the baby will be started on IV fluids to replace the lost fluids, the lost water. The baby will be started on antiemetics. These are medications that help stop vomiting. They will also be on antibiotics if the cause of the diarrhea is bacteria, and they will be admitted to the ward for further management. So, what are the complications of gastroenteritis? Number one, we have dehydration. These babies lose a lot of water through diarrhea, plus electrolytes, so they will be dehydrated, number one. That means they will lose a lot of water, and when they lose water, water goes out with very important components in the body called electrolytes, and so they will have an acute kidney injury. So when the baby loses these important components called electrolytes, they will have acute kidney injury, and so they will be needed to be admitted in the wards to replace the lost electrolytes, sodium, potassium, and also to be rehydrated, so that to 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 help the kidney. So what are the preventive measures of acute diarrheal disease? Number one, there's a vaccine called rotavirus. All moms are required to take their babies. There's an immunization schedule. Make sure your baby gets all the vaccines as per recommended by the World Health Organization, and you will be advised by the nurse or the doctor. The baby will be given a rotavirus vaccine. Teach your children to wash hands at school. At school, at school, these babies go to the toilets, and they are so innocent, they don't know. So please ensure you teach your child that every time they visit the toilet, they need to wash their hands to avoid, as we said, the route of transmission is from the feces to the mouth, fecal oral. If they go to the toilet, or they touch a surface, maybe there was a baby who had a diarrhea, and then babies are careless, and then it happens that your baby comes and maybe touches a surface that is infected, and then babies, they like putting everything in the mouth. So make sure you teach your baby that once they visit the toilet, they have to wash their hands after visiting the toilet. Also, teach children to wash hands before eating. Before eating anything, teach children to wash hands. Moms, make sure you wash your hands every time you finish changing a baby's diaper. Wash your hands, because you can transmit once you change a baby's diaper and you don't wash your hands. If this baby had a virus, the rotavirus, you don't wash your hands, you can transmit the virus from the baby to another. So please ensure you wash your hands after changing the diapers. We also have general hygiene. That is general hygiene. Wash hands before eating, wash hands after visiting the toilet, wash hands when wash foods with clean water before eating, because also ensure that the water that you take is purified. Just boil water or treat water, because as I said, people pass stool in swimming pools, and so also the water that you take, you might not know this tap water, you might not know where it passes through. So ensure that your drinking water is always boiled or treated, and also ensure you cook foods well. And if you are eating raw food, that is, maybe you are eating fruits, make sure you wash with clean water. So that is a brief discussion about acute diarrheal disease, and a point to note to all mothers. If your baby has a diarrhea episode more than 3 days a day, please take that baby to the hospital as soon as possible. As soon as possible. Do not sit at home with a baby who is diarrhealing and also not feeding, and then you want to stay with that baby in the house for 2 days. Doing what? So if you notice that your baby is not feeding well, and also, or your baby is having a diarrhea, please make sure you visit the hospital so that the doctor will advise you. He will let you know if this baby is okay to stay within the home, or this baby will need an admission. Please, let's do justice to these babies, because I have encountered so many cases. You find mothers staying at home with a baby for 5 days, baby diarrhealing, baby not feeding. A mom staying at home with a baby for 5 days. Surely you are doing injustice to that kid. Please ensure you take the kids to the hospital as early as possible so that you can get the doctor's advice. So that is a brief discussion, and I hope you have learned something. At least if you haven't learned, please take home the prevention measures. Make sure you teach your babies to wash hands, also maintain practice proper hygiene, and also note that once a baby passes loose stool for 3 times, that is a baby you need to take to the hospital urgently so that he or she can be treated. Thank you for tuning in. Please don't forget to subscribe, and also don't forget to share with family members and friends, and also don't forget to like. Thank you so much for tuning in. See you in the next episode of Learning. Thank you.